It's time for On Point, where we speak to experts to delve deeper into key issues in the spotlight right now. While the rest of the world has eased most COVID-19 measures, China is sticking firmly to its zero-COVID policies.
That's right. The government insists that their policy is the best measure to make sure hundreds of thousands of its citizens don't succumb to the virus. But how much further can they go to implement these measures? Well, we connect with Ben Cowling, Professor of Epidemiology at the University of Hong Kong. Good morning to you, Professor.
Good morning.
So first and foremost, I was kind of taking a look at the peer-reviewed study published by Shanghai's Fudan University in the Nature journal, which said that if the government lifts its zero-COVID policy, the country could see upwards of 1.55 million deaths. Now, this is due to the low vaccination rate among the elderly population. So why is there a low vaccination rate among the elderly there?
Well, quite a number of factors have played into that. I think one of them is the low level of perceived risk. Remember, in China, there's been very little COVID in the community in the past 2 years. And so unlike other parts of the world, it hasn't been a feature of people's lives that they've seen people get COVID. And for older people, they've seen people they know get COVID and possibly need to go to hospital, possibly worse. So I think that's one of the major reasons, the low perceived risk. And then there's also trust in authorities and unfamiliarity with vaccines and so on, and many other reasons. But the fact is that the vaccine coverage is not that high in elderly.
And well, Professor Cowling, then, China's zero COVID policy, now that's one of the strictest in the world, if not the strictest. So why can't China just make vaccination mandatory among senior citizens, considering that they're already imposing very strict measures?
Well, it's not easy to do that in practice. It's not easy to figure out a way to force older people to get vaccinated, even if they don't want to. For younger people, there's a way to do it by restricting access to public spaces or to work or to public transport or other things. But for older people, that may not work so well if they're mostly staying around their homes and not going out too much. And one other issue is for China, because they have this zero COVID policy in a way, as long as it keeps working, they don't need to worry so much about vaccine coverage in the elderly. That would be like a plan B. But if the plan A, the zero COVID plan, works, then actually it is not an urgent priority to get that vaccine coverage up. I'm worried about it because I'm not sure that plan A can succeed. But in China, if they're confident in their plan A, then you can also see why they might not be pushing for that vaccine coverage in elderly to go up very, very soon.
I mean, certainly China very confident in their zero COVID policy, but at the same time, the WHO chief saying last week that China's zero COVID policy is actually unsustainable, considering the behavior of the virus now. So what's your take on his assessment?
Well, look at the disruption that's been caused in Shanghai in the past 2 months. It's a phenomenal level of disruption just to bring cases back down to a low level. And I don't think the disruption is over there yet. And of course, in the coming weeks or months, there could be more outbreaks in Beijing, Shanghai, or other big cities requiring further lockdowns again. And so now that we have vaccines available, there is another path for China, following the path in other countries, to use vaccine coverage at a high level to mitigate the impact of COVID and to move away from the zero COVID strategy that's worked so well in the first 2 years of the pandemic.
And despite its earlier success, Professor, the zero COVID policy is seemingly flawed. So how do you suppose China should adjust to the current situation? What would be the best method moving forward if, let's say, you were in charge of implementing measures in China?
Well, I'm not in charge, of course. I would say my recommendation would be to set a timeline for the end to the zero COVID policies, meaning the very stringent lockdowns in cities, and also the travel restrictions ultimately, perhaps later this year, have a timeline for that, and then push particularly older people to get vaccinated with the message that they are likely to get COVID in the coming months, and it would be much better for them if they were vaccinated when they got COVID rather than if they were not vaccinated, and then use every tool available to get the vaccine coverage up and to prepare the community for the subsequent surge in cases once the COVID measures are relaxed.
Professor Cowling, let's kind of shift away from China for just a bit here. South Korea is, of course, set to soon, maybe in a month's time, who knows just yet, but lift its 7-day mandatory quarantine soon. How have other countries that have already lifted this measure fared afterwards?
I think we have to be clear on that there'll still be a recommendation for the isolation. I think this is isolation after people have got COVID. They need to isolate for a period of time, at the moment 7 days. Other parts of the world still have recommendations in place that people with COVID should isolate at home as much as possible, and they try to encourage businesses to facilitate that with paid sick leave and so on. It's not a policy, so the mandatory isolation is not a policy that can be kept in place forever. I do think that it's right to move to a recommendation and hope that most people comply with the recommendation. So in other parts of the world, when that happens, there's not a lot of change because most people can comply. And so that there's not actually a major difference when you reduce it from a mandate to a requirement. But we'll have to see what happens in North Korea. Worst case is that there's a slight rebound in transmission, but I don't think it would be a big rebound given what you've already been through in recent months.
Thank you very much, Professor Cowling, for your insights. We'll speak to you again next week.
Thank you.